Madam President, at the eve of your first State of the Union address, I have put together a presentation for your consideration to assist in the creation of your speech. The topics I will be sharing with you are three that are high in the minds of American people, and they are healthcare, the economy, and national security. First on the list is the opioid crisis that is happening in this country. The overdose and deaths related to opioid usage is at epidemic levels. The FDA estimates that deaths from overdoses have more than tripled since 1999. In 2014 alone, the deaths totaled to more than 28,000. However, there are many who feel that it is not nearly accessible enough to medical personnel or to the general public. Everybody from the federal government down to the state and even local governments are taking initiatives to combat this problem. A quick response to an overdose can prevent brain injury and death. One of the things that we need to do is to extend the liability protection to people to administer a life-saving drug without negative consequences, according to the Elements Behavioral Health. Senator Edward J. Markey says that we need to create legislation to allow a non-licensed first responder to administer Narcan, which has been suggested to the Judiciary section of the government as a proposal. And this proposal allows the protection of friends, family, and emergency workers, and it extends the liability protection to those who give treatment. There will be no negative consequences to those who administer Narcan. Another way to help this opioid epidemic is to prevent drugs from entering the U.S. at all, passing legislation that assists countries such as Mexico and China to end the production of drugs in their countries. It also promotes law enforcement to reduce consumption and to help people who are already addicted and are struggling to remain clean. We need to be able to provide better prevention, accessible education, increase the availability, accessibility, and improve treatment and recovery programs. The federal government proposed a House bill in April 2017. It is to help the Mexican and Chinese governments promote law enforcement, end drug production and importation, and to reduce illegal supply, and increase services such as prevention, treatment, and recovery programs. Senator Edward J. Markey suggested that we need to create a judicial proposal that protects friends, family, and emergency workers to extend liability protection to those who give treatment and to those who give Narcan, whether the person lives or dies, will receive no negative consequences. On the state level, the state of Pennsylvania and the governor, Tom Wolf, has introduced Act 139, which allows non-licensed first responder organizations to obtain, carry, and administer naloxone in the event of an opioid overdose. In Adams County, Pennsylvania, the district attorney, Sean Wagner, has extended permission to the police departments to carry Narcan and to allow the individual police officers to carry Narcan. The Gettysburg Police Department has agreed to carry the Narcan in their department buildings as well as having the individual officers. The next topic of discussion is the economy and how it is affected by the American Care Act. Whether or not the American people are able to afford health care and insurance, or even be able to receive it, and medical care directly affects the economy. What is happening is the Senate and the House have both created plans, yet neither has been approved. So, no one really knows whether it is going to be removed, repealed, replaced, or left in place. In a poll done by the Kaiser Family Foundation, 30% were in favor of replacing the ACA. They feel that insurance premiums and deductibles are much too high, and that citizens are being forced to buy from an ACA insurer. They also feel that no more insurance marketplaces exist, but it has become a monopoly instead. In the same poll, 55% of Kaiser poll takers wish to keep the ACA. Under the ACA, states can expand Medicaid coverage. Hospitals saw a revenue increase because people can pay their medical bills, and those who would otherwise not be able to come in for treatment or choose not to because of their inability to pay, got care and treatment for their conditions. If the ACA were to remain in place, states would continue to get a stipend for treating patients. The ACA also has allowed low-income adults without children, people with disabilities, the elderly, families with children with disabilities, and everybody else in between to get medical care in the 30 states, including DC, with an expanded Medicare program. If the ACA were to be replaced, there would be severe changes to Medicaid. It is the second biggest expenditure per state, only to education. And 20 million people will not have any access to available or affordable insurance because they will not be able to pay for it. Our country will become more ill than it already is, and no one is going to be able to receive the care that they need for even the most manageable of conditions. It is recommended that the federal government leave the ACA in place. It is far from a perfect system, but has saved millions of lives since its inception. We need to fix the parts that are not working so that it can provide better health care, more accessible health care, and more complete health care to individuals who need it. And to the organizations and companies providing the care, we need to protect the right of the American citizen to be provided this care. The decent level of health care that our taxes are paying for with Medicaid and the ACA. And it needs to happen without regards to someone's economic status, race, religion, sexual orientation, or gender identity. It needs to be in place for every single American. Tom Wolf, the governor of Pennsylvania, wrote to Senator Pat Toomey telling him that he is against the overturning of the ACA. He implored to Toomey that health insurance needs to be made more affordable by controlling costs and stabilizing the market. Currently, there are no state assists when it comes to the protection of citizens if the ACA were to be overturned. Locally, many mayors and government officials are working with state and local governments to fight for their citizens and to retain affordable and proper health care. Yet, there are no current local protections for patients and citizens. Finally, I wish to discuss cyber terrorism as it relates to national security. Cyber terrorists and hackers have become very sophisticated in the latest years. It makes our nation's secrets vulnerable, and it makes our nation's citizens vulnerable. The Department of Homeland Security has taken it under itself to strengthen the security and resilience of cyberspace. For them, it has become an important Homeland Security mission. On the federal level, the NSA has been considering segmenting its agency into a specific branch dedicated to cyber intelligence. They are making cyber an independent military command because a division of this nature will put the fight in digital space on the same footing as more traditional realms of battle, on land, in the air, at sea, and in space. On the state and local level, we need to be able to bolster the network security in the power grid, particularly to nuclear power plants. We also need to provide education on how to deal with cyber threats and being prepared and knowing how to recover from an attack, as well as being able to identify and verify that a breach is actually a cyber terrorist threat. This is paramount. The federal government is determined to ramp up their presence with the NSA division as well as the Department of Homeland Security to ward off cyber threats. In Connecticut, they are implementing education, preparation, recovery, and verification operations. The Connecticut governor feels that Washington is holding up its end of things. Therefore, the state needs to follow suit to make the federal job easier. And states need to take the initiative in improving that which makes their state vulnerable to cyber attacks. On the local level, in the Oyster Creek nuclear power plant in Lacey Township, New Jersey, they were concerned of cyber threats hitting nuclear plants, especially since the American Society of Civil Engineers gave our national grid a D+. They will be following suit with states and the federal actions to improve their vulnerabilities, as well as improving their ability to recover from attacks and educate their employees about cyber terrorism. They also need to prepare their citizens about how to deal with a nuclear meltdown. They need to make sure that what is in place is evacuation and safety plans long before it ever happens. Thank you, Madam President, for taking the time to watch my presentation, and I hope you consider these points for your very first State of the Union address.